Hey everyone, I'm Dr. Stephanie and I'm a physical therapist. And today I want to talk about frozen shoulder, about what it is, what are the symptoms, and what you can do to treat it. So, we're going to go through several exercises that will help increase your shoulder mobility, increase your shoulder strength, and get you to feeling better and get rid of that pain. So, what is frozen shoulder? Basically, frozen shoulder means that it's also called adhesive capsulitis, but it means that you don't have your full range of motion. So maybe where you lifted your arm all the way up overhead before, you can only lift it to about here without extreme stiffness and pain, or you can't reach behind your back here or reach over your head where you could before. And sometimes this happens because of an injury or surgery, and sometimes it just happens and there's no cause, or there may be a cause but you don't remember. Maybe you reached for something or you fell, but it didn't hurt at the time, and then later you started experiencing symptoms. So with frozen shoulder, the capsule, which is the kind of connective tissue that encloses the joint in your shoulder, that connective tissue gets thicker and tighter. So if it's an injury or surgery, then something gets irritated, and then that capsule, that connective tissue gets thicker and tighter to kind of protect the area. But when it gets thicker and tighter, it causes pain because it's so tight that you can't lift your arm or you can't move it in certain directions, and that's painful. So the goal of treatment is to reduce those restrictions, get your shoulder moving again, and build up that strength. Now, frozen shoulder can last a significant amount of time. There are actually 4 different stages. So there's what's called the pre-freezing stage, and that can last a month or two. And that's usually when you're first starting to experience symptoms and you don't really know what's going on, but you kind of notice you don't have as much mobility, maybe you have some pain in your shoulder. And then you get into the freezing stage where your motion gets more and more limited, it gets more and more painful, you can't do certain things anymore. And that can last several months. And then you get to the actual frozen stage. And that's the longest stage. It can last from 9 months to a year or two. And doing physical therapy, doing these exercises I'm going to show you, will help speed up the healing process, help improve your mobility so that you're not, even if it lasts 2 or 3 years, you're not having as much pain and you can move your shoulder more than you would if you just left it alone. So that frozen stage is just where you can't move your arm past a certain point, you're having pain, but as the time goes on, usually pain lessens and lessens and your mobility improves. And then you get to the unfreezing stage, and that's where everything improves more and more, and eventually you get back to hopefully your full range of motion that you had before you had frozen shoulder. So all of this can take a while to heal, but definitely doing these exercises I'm going to show you today will help improve that mobility. And that's kind of the goal, is to keep your shoulder as mobile as possible, because usually if it hurts, you don't want to do it. So if it hurts to lift your arm, you're probably just not going to lift your arm. But if you work on some of these stretches and kind of gradually get your shoulder to move again, then it won't hurt so bad to move in those directions, and you won't lose so much mobility. So what we're going to do, I'm going to show you 6 different stretches, and these are things that you can do daily if you want to. You may have some pain because frozen shoulder can be painful, and you do want to try to increase your mobility, but you don't want to have severe pain. So just do them within your tolerance, and you may be able to start with some and gradually move on to the other ones. But all you need is, I'm going to use a golf club, but you can use a golf club or a broomstick or a cane, any type of stick. And then I'm also going to use a small weight. This is 3 pounds, but you can start, and I'll show you as we do the exercises, we can start with no weight and gradually work your way up to some weight just as your shoulder improves. So we're going to lie on our back first and hold on to the golf club in both hands. Now I'm doing this on the floor on a yoga mat. You can do that as well, or you can lie on a bed or a couch, whatever is most comfortable. You're going to hold on with both hands. You're going to try to keep your elbows straight and just lift your arms overhead as far as you can comfortably. Now, if you have frozen shoulder, you probably won't be able to go all the way. So go to where you can. Then you want to pause for a second or two, kind of get a good stretch there, and then come back down. So let's say my right shoulder has frozen shoulder. So you're gonna, when you lift, you wanna kind of use the left arm to pull a little bit and maybe even drop it down a little so that you're stretching this right arm a little bit. So when you get to that point, hold for a couple seconds and then come back down. You want to repeat that 20 to 30 times. Just get a good stretch. And this is one you can definitely do every day. This really helps improve that mobility. And it shouldn't be too painful. And you control how much it hurts, basically, because you're trying to get a stretch in that shoulder. So go to wherever you can go, just kind of stretch it out, and then come back down. So 20 to 30 of those. And then we're going to do one more on our back. This one I'm going to show you with the weight, but you don't have to start with the weight. So you want to bring your arm up to 90 degrees. If it doesn't go that high, you can keep it down a little bit. We're going to try here, and I'm just going to have you rotate your hand and forearm backwards as far as you can. The weight helps kind of pull it, but if you do have frozen shoulder, you may not be able to go down as far. So if you want to start with the weight, go ahead. If it hurts, then go ahead and start without the weight, and then you're going to go the opposite direction. So this is an internal and external rotation. So down as far as you can, and then back down here. If you want to put a little pillow under your upper arm, sometimes that's a little more comfortable, so you can do that as well. Just go back and forth. Again, about 2 to 3 sets of 10. And just try to increase that motion there. Okay, then we're going to lie on our stomach. So you're going to lie on your stomach, and you're going to take the arm that has frozen shoulder, and you're going to thread it underneath your body and put the other arm straight out in front of you and try to get a stretch there. You'll probably feel a stretch in the front of your shoulder. And you can, if lying down completely on it is too much of a stretch, or sometimes people say it pinches a little bit, push yourself up a little bit, kind of go on your elbow, and just go under as far as you can comfortably. Now this one you want to hold. So this one hold for 10 or 15 seconds, and then you can come up and relax. If you only have frozen shoulder on one side, you don't have to do the other shoulder, but I would recommend doing both sides, because sometimes if you have it on one shoulder, you're more likely to get it on the other as well. So you may as well kind of start doing some exercises to prevent it. So hold 10 or 15 seconds, repeat that 5 to 10 times, just depending on how it feels. Okay, then from there, you're going to come up onto your hands and knees, and what you're going to do is you're going to take the arm with the frozen shoulder, you're going to do a row here, and then rotate up, and then come back down and back down to the floor. So row, rotate, and you may not be able to rotate far. So if you just, even if it's just a little bit, that's fine. Come back down and back down to the floor. So up, and the goal on all of these is to rotate, to move as far as you can, to really work on increasing that range of motion, and then back down. So just row up, and then rotate, and back down. Try to do 2 to 3 sets of 10. I would probably do it on the other side as well. You can also notice the differences between your arms. So you may try this and you can hardly rotate, and then try this side and you can rotate all the way up. So you can kind of see where your goal should be. Okay, so next what we're going to do from here is a child's pose. And so you're going to sit back on your feet, put your arms out as far as you can, and just kind of try to sit back. And you may not be able to go that far, and that's okay. The goal is to kind of get a stretch in your shoulders, just as far as you can. Again, hold this one 10 or 15 seconds, and then come back up. And then push them out as far as you can. Hold another 10 to 15 seconds. And I would repeat that one 5 to 8 times. Just see how it feels. Okay, then what we're going to do is grab onto this golf club again. And I'm going to show you kneeling, but you can stand for this one if you want to. You're going to place your hands behind your back, and the goal eventually is to bring them closer together. But when you're first starting out, you may have to keep them out to the sides. And this one, you're just going to lift the golf club behind you, just as high as you can, and then back down. So just lift up and back down. You want to make sure you're in a good posture, kind of shoulders back. Just lift as high as you can. If you can't lift as high as me, that's definitely okay. Just lift and back down and lift and back down. So do that as many times as you can. And then I'm going to show you one more with this golf club. Now you're going to try to bring your hands as close together as you can. If you can't bring one of them that close, that's okay. You're just going to bring one right behind you and then take the other one. And the goal, you're going to take the golf club, kind of rotate it. You're going to try to pull your arm up your back. So when you're first starting out, you may just be trying to pull it across. And sometimes you can't get that far. So just pull it across, and then you're going to try to pull it up your back. And then eventually, when you get good, you can take it like this and try to rotate it up your back. So I'll show you from the back. So this is kind of the eventual goal. But usually when you're starting out, you can just start here and try to pull across first, and then try to pull kind of up that way. And then you can turn the golf club and try to pull it up your back. And again, you can do this on both sides to see, which side has more motion. Compare your frozen shoulder to the good shoulder, or if you have it on both sides, you can do both sides and just see how it feels. So all of those exercises you can do daily. Try to work on increasing that motion. Obviously, try not to increase pain. So do all of them within your pain tolerance. They may be a little bit uncomfortable at the end of the range of motion, but as long as you're okay, you're comfortable, you're not killing yourself, then it's okay to do them daily. So do all of those. Hopefully that increases your pain, increases your motion, and gets rid of your frozen shoulder eventually.